Okay, so I haven't officially thought of an introduction for this YouTube channel. Hold on, let me stop the fan. Give y'all the crisp and clear audio. So I haven't officially thought of a intro for this channel. You may have seen me though on YouTube. I have a music reaction channel called Favour Reacts and a cultural reaction channel called That American Girl. Now technically this video could go ahead and go on my culture reaction channel, but I wanted to put it here because it kind of touches on a more personal part of me, which is nursing. As a lot of you know, if you've been on my other channels, then you know I am currently in my last semester of nursing school and have already received an offer to be a NICU nurse post-graduation. And a big part of me wants to try travel nursing after I get some experience. And number one thing that I want to do, aside from like US travel nursing, is going international, Canada, going to the more impoverished countries, vacationing and working at the same time in London. Like, all of that sounds like a dream to me, but to do that, I kind of have to understand better the healthcare systems of those countries. So, what are we doing today? That was a lot of talking. We're doing healthcare in the United Kingdom, just trying to get an understanding of how y'all system works. I know about the NHS. I know that it's mainly paid for through your taxes, just like university or college. But what is the nitty gritty, and how does nursing like play a role in healthcare for y'all? So we're going to be reacting to that. Subscribe here for more vlogs and get to know me more on a personal level, and to get more nursing or healthcare videos, I guess. And like the video, so I know you want me to do more stuff like this. I want to reiterate though that this is not a reaction channel. This is a vlog channel where you get to learn about moi. Anyway, let's get into the video, shall we? Go ahead and subscribe to the other channels too if you're not subscribed there. They're all listed somewhere. Anyway, here we go. Healthcare in the United Kingdom.
We've done the United States, Canada, and France.
Ooh.
None of them are really socialized healthcare systems. To get at that, we need to go look at a system like that of the UK.
Not me kind of getting triggered already by the word social. Like, America has made me think so many things are bad that are actually just good for the people, and they want you to think that they're bad so they can still continue to take advantage of you. Like, there's no reason I should like cringe at the word socialism, but he just said it now and I'm like, ooh, that's a bad thing, when really it would benefit me anyway.
More specifically, the National Health Service of England is the topic of this week's healthcare triage.
National Health Service, NHS.
People like to throw around government-run healthcare as a phrase. Most of the time, it's a little hyperbolic. But in the case of England, it's actually pretty accurate.
Nice.
The National Health Service there provides care to everyone, all kinds of care. The system covers everyone who's ordinarily resident in the country. Basically, that means everyone except visitors and illegal immigrants.
So citizens, basically. It's kind of like Medicaid and Medicare, right? Except it applies to everyone in the country, not just like specific groups of people. Like Medicare is for, I believe, people who are 65 and older, versus Medicaid is like for the low income families. And I believe there's more things for children too we have here, but the way he's talking, it's like a national thing, like everyone would apply or be able to be served in the hospital, basically.
But even those groups can receive free care in emergency departments and for certain infectious diseases. Coverage is pretty broad. Preventive services, inpatient care, outpatient care.
Basically the entire healthcare system. Gosh dang. Inpatient, outpatient, rehab, mental health, and all of palliative care. I was thinking about doing hospice, but that'll probably be like further down in my career. But like, it's not just like the emergency room, it's a free visit. Like if you need like inpatient, for example, or to be admitted, or it's long term too. Holy crap. That's expensive though. Y'all have enough taxes to cover all that? That's crazy. Physicians,
drugs, dental care, mental health care, palliative care, rehabilitation, long-term care, even some eye care. It's all covered, and it's pretty much free to citizens.
I had to pay $100-something for these dang glasses. Ugh, and they give me a headache.
Once they've paid taxes. Almost everything I mentioned just a few seconds ago has no cost sharing whatsoever, with the exception of dentistry and outpatient drugs.
1 second. Josh! Josh! What? Can you preheat the oven? For what? 400. I want to make a pizza. And I'm filming right now.
The latter have a copay of just over
Perks of having a sibling little brother. Gang.
£7.5. Inpatient drugs, on the other hand, are still free. And there are groups
Wait,
that are...
wait, sorry. He said even the prescriptions are free? Sorry, I'm running it back a little bit. I missed that. I was thinking about my pizza.
Share.
Side note, let me know if you love Hawaiian pizza and barbecue pizza, because if you do, we're besties officially. Those are the best type of pizza out there.
Whatsoever, with the exception of dentistry and outpatient drugs. The latter have a copay of just over £7.5. Inpatient drugs, on the other hand, are still free. And there are groups that
$7 or free. Either way, you're living well.
are exempt even from outpatient drug copays. Kids under 16, no copays. Kids 16 to 18 who are still in school, no copays. If you're 60 or older, poor, pregnant, have had a baby in the last year, or have a number of chronic diseases, no copays. It turns out that only 6% of prescriptions actually incur the full copay in England. So
only 6%. It's like, can I even imagine healthcare like this? Like the time I needed to get my wisdom teeth out, I got like $1,000 covered with insurance, but I still had to pay $1,500 out of pocket. So I paid more out of pocket than my insurance even covered. So, I mean, I don't want to say like what's the point of the insurance, because it did still cover $1,000. But if I'm paying more than my insurance company, what's the point of the insurance company? Man, free healthcare. And when I say free, I know it's taxes, but free to me. What a dream.
out-of-pocket costs in England are really, really low. Public expenditures cover more than 80% of all healthcare spending. About 3/4 of that comes from general taxes, and most of the rest from a payroll tax. Over-the-counter drugs and other medical products account for another 10% or so of spending.
Oh, well, I'm an idiot. I was about to say, because y'all know, if you haven't, or if you didn't know, I've actually been to England. I spent like a whole summer there. I have a bunch of vlogs on the channel if you want to watch them. But I was thinking, instead of getting my wisdom teeth taken out here, I should have just did it in England. But you have to be a citizen to get all that free stuff, so never mind.
The rest is mostly private hospital care for elective procedures. A lot of this is covered by voluntary health insurance, most of it part of an employer-based benefit system. So basically, about 10 to 11% of the population has private supplemental insurance.
Oh. 2
private insurers cover about 2/3 of all of those people. People are required to register with general practitioners, who deliver the vast majority of primary care.
So it's a requirement to have a PCP. Over here, it's not even required to have health insurance or health, anything. And it makes me think, like, if we focus more on, like, preventative care rather than, like, a rapid response to, like, if you have a hangnail, why don't you just go get your toenails clipped instead of waiting for it to get infected, and then all of a sudden we have a gangrene situation? You know what I'm trying to say?
Most GPs work under a national contract with the government and are paid through capitated services, a bit of fee-for-service, and bonuses for good performance. But unlike most other countries, GPs actually work for the government, as do specialists. Almost all of them are salaried at hospitals run by the NHS.
Okay.
Patients have more of an ability to choose not only which hospitals they'd like to go to, but also which specialists they'd like to see in those hospitals than they have in the past.
I like that too. He keeps mentioning how it's all kind of controlled by the government, which I'm kind of... It would put into question, like, what does government to y'all mean? Because whenever he says, like, the government, I'm thinking, like, the monarchy is controlling your healthcare system, but at the same time, I know that there's a prime minister and the cabinets and all those people. So is it the monarchy that he's talking about, which I would not like, or is it, like, these people that y'all can vote in or vote out, like a democracy type thing that we have? Let me know. Because if it's the monarchy controlling everything,
About half of specialists treat some private patients in private hospitals as well. Publicly owned hospitals are run by NHS trusts. They're paid for care at nationally negotiated diagnosis-related group rates, or DRG rates. Some care is purchased through the private sector, especially for mental health and elective care. Finally, the NHS pays for long-term care, although less today than it used to. Those who make less than £23,250 are entitled to free state-funded residential care.
And hopefully free housing, man. Because it's expensive to live in London. They say it's like the New York City of England, so...
Most residential care is paid for by the private sector, though. End-of-life palliative care, however, is provided by the NHS in hospices, homes, or even hospitals. What's great about the NHS? It's cheap.
Everything?
In 2011, England spent about 9.4% of GDP on healthcare.
United States of America? Percent of GDP health expenditures as of... Okay, well, how are we the highest on the list? Wait, maybe I'm looking at this graph wrong. So this means you spent the most amount of money on your healthcare system. But what do we have to show for it, America? I'm confused.
Compared to the OECD average of 9.3% and the United States 17.7%. They spent $3,405 on healthcare per person, which is just above the OECD average. But that $3,405 is only 40% of the more than $8,500 per person spent in the US. The number of physicians per 1,000 population at 2.8 is lower than the OECD average of 3.2, but above the United States 2.5, which means they have more doctors than we do. They produce higher than average numbers of medical graduates.
And no, it's not because schooling here is easier. Why don't you go take the MCAT and tell me if it's easy? And if you pass it, I'll shut up. But I already knew someone was going to comment, well, it's because the American education system is shite. No, your opinion is shite.
Graduates as well. Life expectancy at birth is 81.1 years, above the OECD average. Mortality from cardiovascular disease is similarly better than average. Cancer mortality is below average, though it's worth acknowledging there have been better than average improvements in the last decade or so. Infant mortality rates are low, as are suicide rates.
Good.
Diabetes prevalence is low in spite of the English diet.
Obesity is what we're known for, buddy. No sympathy there for y'all. Come on, that's us. But what I was gonna say, I wonder what the comparison is in, like, what do you even call it? How long people live in the U.S. compared to the U.K. Men and women. Let me know.
The percentage of adults who report being in good health is well above average. And they do this on a shoestring. Imagine if we in the United States spent 40% of what we do right now on healthcare. We'd have an extra like $1.6 trillion or more to play around with. Yeah. We could massively increase spending on tons of other programs and still have a surplus.
Because, well, they want you to be sick so that they can still make profits off that. They have to sell you stuff. They have to give you care. They want to make money. So to keep you sick makes them money. So obviously they don't want everybody to start being healthy and preventing these illnesses. Like, you know?
Our downsides. In order to keep spending so low, the NHS makes certain decisions other countries might find unpalatable. Some drugs are unavailable. Technology is nowhere near as prevalent as in other countries.
Okay, but he's not. I mean, at my hospital system, we use Meditech, which, if you're familiar with the healthcare system, you know it's like the ancient type. But there's also things like Epic or, you know, all the other charting systems. He's making it seem like y'all are still using paper, which I highly doubt. So what does he mean by, like, y'all's stuff is just not up to date? How? Explain why.
Hospital beds are even scarcer than in the United States. Physicians and nurses work pretty hard. Hospitals aren't geared towards personal comfort and can be overcrowded, understaffed, and sometimes even dirty from what I hear. Waiting times can be longer than in other countries. And on many metrics of quality, the UK falls below where they would like to be. They're working to try to fix some of this. They've tried to increase patients' abilities to make choices. Providers are given more incentives to improve quality. Transparency and accountability are increasing. But as with almost
literally all of those angers or whatever, literally, even here, everything could be fixed with higher pay. That's literally it.
All of these episodes, it's important to remember that Britain is a free and democratic nation.
Democratic monarch, right? I think I'm right. Democratic monarch. Yeah.
Chose the NHS, and they do so again and again.
Nice.
They love their healthcare system.
Nice.
And even elected officials from the...
I would too if I'm getting everything for free.
And again, they love their healthcare system. And even elected officials from the Conservative Party support it. There are trade-offs to healthcare systems, as there are with so many things in medicine. It's easy to demonize socialized medicine for its shortcomings. We can't ignore its financial benefits, though. The NHS may not always be the best, but it certainly can lay claim to being efficient.
Then the reason I think it's beautiful that y'all have it, but no, it would never work here, is if you pay attention to our politics, then you would have known that Biden just announced that he's going to be canceling student debt. Obviously not all student debt, there's limitations. If you want to know that info, go look it up. But there are already people from the conservative side of America saying, like, well, I just paid off my loan, so what about me? Or when you take out a loan, you do it knowing that you have to pay it back, so you shouldn't get anything. Or like, just things like that. Like, they don't want other people to prosper because they don't get the same benefit, kind of thing. And so if y'all had universal health care, it would be, why am I paying taxes for this guy who has liver cancer and needs a transplant? It's not my problem. And that's why universal or socialized healthcare would never work here. We're just too selfish and we don't care enough about our neighbors. When it comes down to the dollar, we do it morally and we're very emotional and supportive of each other, but when it actually comes down to financing each other, not gonna happen. Yeah, it's a nice theory and would be a dream, but I don't see it happening. Let me know your thoughts on it though. Where can we improve? Where do you think you can improve? And yeah, bye.